What we've been doing today is taking part in the launch of the Tackling Acute Kidney Injury project. We are one of 4 hospitals which will be rolling out a national programme sponsored by the Health Foundation Trust. It is a fantastic initiative that will see benefits to the health community with which we serve. Doctors, nurses in Ashford and St Peters will be able to access a wealth of resources and expertise as a result of being part of this very special project.
Hi, I'm Dr. Ian White. I'm clinical lead for AKI at Ashford and St Peters Hospital Foundation Trust. Today I was speaking about the Health Foundation project that we're involved here with at Ashford and St Peters. It's a project that is tackling acute kidney injury. The project is a step wedge design project. There's a step wedge design because it takes out the bias of the practice of treating acute kidney injury. The results will all be analysed by the renal registry and will be available after the whole project has finished. It's something that we're very proud to be involved with here at Ashford and St Peters Hospital.
Hello, I'm Dr. James Marsh. I'm a consultant nephrologist and I provide the renal services to Ashford and St Peters. Today I've been talking about acute kidney injury and the importance of optimal management. Acute kidney injury is very important and it's quite common. It probably affects about 10% of patients presenting to the acute medical take at St Peters Hospital. I'd like to consider acute kidney injury as a risk factor for recognising acutely sick patients. There's a lot of evidence that historically it's been under-recognised and suboptimally managed. And this is important because the long-term consequences of inadequate management of acute kidney injury is that patients might have a longer length of stay in hospital, increased mortality, and a long-term decline in their kidney function. The importance about recognising acute kidney injury is that with prompt management and appropriate resuscitation of the patient, we can reverse the decline in kidney function in 20 to 30% of patients, which could have a very significant impact on their long-term outcomes. I think that this launch is a very exciting opportunity to educate junior doctors and nurses about the recognition of the risk factors for acute kidney injury and the early prompt management of patients with appropriate investigations and referral if necessary. If we can get things right, I think that we can have a very beneficial effect on our patients.
Hello, my name's Sue Wilson. I'm the acute kidney injury lead nurse for Ashford and St Peters Trust, and today we've been talking through the practicalities of implementing a care bundle for acute kidney injury. From the 1st of December, the labs will be phoning through all acute kidney injury stage 2 and 3 for you, and also you'll be able to access that information via Vital Pack, which will also highlight the acute kidney injury stage 1. We've put together a little list of your responsibilities, what you do when that information is phoned through to you or when you identify that on Vital Pack. Obviously, education is key to the success of this project and the impact that it will have on patient outcomes. So we've put together a website for you. The website is full of useful resources from clinical guidelines, useful links to external websites, such as the Think Kidneys campaign. There are specific educational packages available for HCAs, junior docs and the nursing cohort as well. So plenty of information there for you to have a look at, and if there's anything that you'd like us to put on there for you, think it might be a useful link, then please just shout. There's also a detailed description of the care bundle, so you can reflect on that at your leisure. But I think the overall message here is about early detection and early intervention, and if we can use the care bundle and implement each of these steps, then we'll be going a long way towards improving patient outcome.
There is a sequin this year which is being launched to improve the communication of the management of patients with acute kidney injury to our partners in primary care. And it's very important that on the discharge summaries, we get across 3 key messages. Firstly, that patients have had acute kidney injury and the stage of acute kidney injury. Secondly, that we tell our GPs what changes to medication we have instituted and to give appropriate advice about when they should be reinstituted. And finally, advice about what follow-up blood tests are needed and the timescale for those blood tests.
Please be aware of what's going on. Please take time to visit the website, and please give us your cooperation as we roll out this project.